With the reemergence of COVID-19 in other countries, the Honorable Minister of Health, Dr. Osaige Emmanuel, during a press briefing at Abuja, the nation's capital, called on Nigeria not to let its guards down in preventing the spread of COVID-19, as some country is currently experiencing lockdown, which is triggered by factors yet to be understood.
With regard to the pandemic, Nigeria at the moment is in a lull with reduction in infection rate and in fatalities. But we cannot let down our oars on COVID-19. The experience from other countries in Europe and presently the experience in China tells us that there can be a flare-up of COVID-19 at any time, triggered by factors yet to be fully understood. NCDC will explain further, but you all know now that the massive, huge city of Shanghai in China is on a lockdown because of an explosion again of COVID-19 in that place. Before that, it was in Europe, in UK and Germany. So the reemergence of COVID-19 from country to country still comes to surprise us.
He also called on the National Assembly to increase national budget on meeting funding of location.
The Federal Ministry of Health and National Population Commission agreed to engage the National Assembly for adequate budgetary allocation towards meeting funding obligations to scale up reproductive health and family planning services, to engage the National Nigeria Governors Forum for their support and also budgetary allocation for reproductive health, family planning services, and so on, to engage development partners for technical and financial support also for reproductive health, to mobilize traditional, religious, political, and community leaders in ensuring the appropriate sensitization and education of community members on the safety of health services, including family planning and reproductive health, to ensure sustained improvement in human and infrastructural resources for long-term provision and utilization of right-based reproductive health and family planning services.
Dr. Adebimpe Adebiyi, the Director of the Department of Hospital Service, gave breakdown of COVID-19 cases so far in the country.
5,036,813. The number of confirmed cases, 255,670. Active cases, 2,653. Discharges till date, 249,874. Number of deaths till date, 3,143. And that brings the case fatality to 1.2%. On the weekly case management reporting dashboard, the reporting facilities on the platform remained 93, and only one death was recorded over 8 weeks. Proportion of confirmed cases admitted with associated or underlying medical conditions, that is comorbidities, is 47%, which is below 50% from the reporting isolation centers. Between the 16th and 18th of April 2022, laboratory findings show that 22 new cases were reported in the country from 4 states, that is Lagos 10, Nasarawa 6, FCT 3, and Rivers 3.
She also said the department is ensuring that the national case management will continue to coordinate case management activities at the sub-national level and continue to build capacity with different levels of health workers.
We continue to build capacity of different cadres of health workers that are involved in isolation and treatment. This also includes biomedical engineers in order to sustain maintenance plan for the equipment and medical devices. Other activities are the various stages of management and equitable distribution of equipment and supplies to the states, particularly the hospitals that run isolation and treatment centers. Sources of some of this equipment, aside from the federal government, are the Global Fund, supported COVID-19 response mechanism, the UNICEF donated items, and support from other implementing partners.
The Director, Department of Primary Healthcare System Development, Dr. Ineka Onwu, applauded all states for doing well in terms of vaccination and encouraged others to scale up in its vaccination process.
Currently, all the states are doing well, but most especially we set a target for states to achieve. Only 2 states have exceeded the 50% target, and that is Nasarawa and Jigawa, with partially vaccinated and equally for fully vaccinated. But top on the list for first is Nasarawa, Jigawa is second, Kano is third, fourth, Kaduna, and fifth. These others, the last 3, have not achieved 50%, but they are in the range of doing that. Our daily vaccination remains solid and steady, and so far, average daily vaccination is about 247,664 plans. We want to ramp up, and that is why we are doing such, and we believe that these daily vaccinations will increase soon as all the festivals. We know we are in the Ramadan, and equally also we just passed the Easter.
She also added that the night vaccination has been included for those observing their fast.
One of the things we've done in the Ramadan is to include night vaccination so that those after eating will also go and do that. Dropout rates are not so good across the states. We expect 10%, but most of the states are still outside that range. The least is Gombe with 25%, and the highest Kogi with 63% dropout from the first dose. You may recall that when we launched the J&J, we also had the vaccine site finder, which was also launched. We are tracking to see utilization, and possibly in the next presentation, we may give that report. But we also need the press to help us pass on this information, because people do say that they are unable to find the vaccine sites because they do not know where it is.
Dorcas Olariwaju, Voicetv, Nigeria.